Hey, I'm Dr. Jerry Williams with Urgent Care 24/7, here to talk to you today about COVID-19 treatment and what we did at Urgent Care 24/7 and why were we successful. This is a very controversial topic, and I know it is, but I want to talk to you about what we did at Urgent Care 24/7, my national urgent care company, and why we were so successful in keeping our patients out of the hospital, and we had no deaths in our treated patients. We also had no hospitalizations in our treated patients as well, and we treated 900 patients for acute COVID-19 infection. The first thing I would say, or the first question I want to ask that is frequently asked of me was, okay, how many patients did you treat? And the answer is about 900. And then the next question was, well, did you treat everybody? And no, we did not. If someone was young and healthy and no comorbidities and they were handling the disease well, we didn't treat them. We gave them supportive measures. But please understand that in all patients that had COVID-19, and in fact, we were having all patients during the pandemic take what we call the vitamin and mineral packet, which included vitamin D3, vitamin B12, vitamin C, magnesium, and zinc. Because all 5 of those vitamins and minerals have very, very compelling, strong scientific data that supports that if you have a ample supply of those vitamins and minerals in your body, that you're more likely to fare well with the illness and survive the illness. So we were encouraging everyone to get those vitamins and mineral levels up in their body, number one. Number two, if we had a patient who was quote unquote really sick and presented with high fever and extraordinary symptoms, or if they had any comorbidity at all, including obesity, diabetes, older age, COPD, asthma, etc. There were many comorbidities. We recommended treating those patients. Despite all the politicalization of the treatments, we stayed out of the politics and we just stuck to the science. And we used hydroxychloroquine, and the reason we did that is because there was a paper from 2006, I believe, that showed the mechanism of action of hydroxychloroquine and chloroquine, 2 very commonly used drugs for anti-malarials, malaria treatments that have been used in millions of patients worldwide. And in the case of hydroxychloroquine, which is the drug that was being studied most recently early in the pandemic, it actually began being studied first in France and showed very compelling data, though very small study, which was certainly not ideal. But what we knew about hydroxychloroquine was, number one, it's an incredibly safe drug. And I don't care what you watched on TV or what you read on the internet, trust me, incredibly safe drug. Case in point, it is FDA approved in all 3 trimesters of pregnancy. And there is nothing more difficult to treat pharmacologically than a patient who's pregnant, especially in the first trimester when the fetus is developing. But yet, with hydroxychloroquine, FDA approved in all 3 trimesters of pregnancy. So, very safe drug, and we checked an EKG on all the patients we treated to get a QT interval, which is an electrical measurement of how the heart is conducting electricity through it to make sure that that isn't getting prolonged and there wasn't an abnormal prolongation of the electrical flow through the heart that allows the heart to beat. So we checked a QT interval with the EKG, and we got patients on hydroxychloroquine and all the vitamins and minerals. And we also treated them with azithromycin, because the early French studies showed that azithromycin was very effective in helping decrease the length and severity of the illness, even better than hydroxychloroquine alone. So we were, again, checking QT intervals on the patients and getting them started on this regimen. And later we added the ivermectin as well. But which is a medication that's also been widely used internationally. And there was discussion and some scientific evidence that was compelling that it was also helping with the COVID-19 infection. But the treatments that we had still need to be more formally studied and proven. During the pandemic, we didn't have time for that. And I know that makes you feel like that we're treating you like a guinea pig. And in some cases, we had to make clinical decisions earlier, sooner than we would have liked to. We would have liked to have had randomized placebo-controlled studies that would have been more thorough. But fortunately, the drugs that were in question were overwhelmingly safe, and there was compelling evidence that they were effective. So we moved forward with that without apology. I would tell you, though, that overall, if when people ask me, why do you think Urgent Care 24/7 was so successful in treating COVID-19 infections, I would tell you this one statement. We started treatment early, meaning we tried to get patients on medications within 48 hours of the first onset of symptoms. And we also worked very hard to get all of our patient population on those 5 vitamins and minerals, which we know improved outcomes by patients, for example, not having a vitamin D3 deficiency when infected. So we think that made a huge difference as well. But let me give an example about treatment of a viral illness that's very common, and it's influenza, the flu. And if you've ever had the flu, or a loved one or a friend, you may know that there's a couple of drugs that we use. We use Tamiflu is the most common one, and then Xofluza is another anti-flu, antiviral medication that's given early in the onset of influenza symptoms. But you typically have to give those medications to the patient within the first 48 hours for them to be effective. Within the first 2, maybe 3 days. Otherwise, past that point, those medications aren't effective. Well, we at Urgent Care 24/7 took that same approach with COVID-19 infections. Diving into the literature and talking to colleagues in internal medicine and infectious disease and pulmonology, came up with a decision that we were going to treat aggressively in the patients that we thought were appropriate for treatment, and we were going to treat early before the virus, the COVID-19 virus, had an opportunity to replicate or reproduce in the body and overwhelm the body with the cytokine storm and the overwhelming inflammatory response to the virus. So we treated very early during that first 48-hour period, and we would have patients literally that would defervesce, meaning lose their fever, within 8 hours of treatment. I mean, they literally would come in and say, I feel horrible, and then they would call us back 8 hours later and say, I'm already feeling better. This is amazing. So we really feel like we made a difference because we treated aggressively and we treated early. So I think there's a lesson to be learned in that with viral illnesses that we'd already learned with other viral illnesses. For example, the most common one, influenza. We knew treating early made a difference. So we applied that lesson we learned with the flu to COVID-19. And we saved a lot of lives, a whole lot of lives. Wish we could have saved more. So anyway, that's my explanation on COVID-19 treatment and why we did what we did at Urgent Care 24/7. Thanks for listening, and look forward to seeing you again soon on another chat about healthcare related topics. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.